Thank you, Madam Speaker.
We asked a question of the Premier in question time this morning about the travel arrival cards and the lack of resourcing and follow-up that is occurring at the airport. The Premier indicated he was concerned to get the answers to the questions that we'd asked, and he was going to come back in today and report. Well, we are here at the end of the day and we haven't heard anything from the Premier on this matter. We are very concerned that this is a first-line prevention measure which must be undertaken properly. It must be stringent, it must be resourced, and people must be tracked. We have always said that it's not good enough to just focus on the people who are arriving into Tasmania from overseas. It must be every person who comes to Tasmania by sea or air, because we know now that mainland states, especially the ones that people most travel to from Tasmania, New South Wales and Victoria, are recording exponential growth in cases. There was 50 cases in New South Wales in the last 24 hours, Madam Speaker. We know that when people arrive in Tasmania, if they've been to come in from those other states, or if they're Tasmanians travelling back, there is no requirement for them to do anything. The truth is that they have been in communities like people who are arriving from overseas where there is exponential growth in COVID-19 cases. We have to protect Tasmanians from community transmission of this disease. Now, what the Premier was to provide us with some information about is the biosecurity resourcing and the lack of the tracking that will happen of people who self-isolate. We know that people are making voluntary identification of whether they've been overseas as they're disembarking. That's not good enough. Absolutely not, because we've heard reports of people pushing past clearly with off-duty goods in their hands. Clearly they've been overseas and they're just ignoring that direction. So there can be all the heavy penalties in the world, but if there's no enforcement and no follow-up, it means nothing. This is such a serious frontline issue that we expect the Premier to use every resource he can muster for the good of Tasmanians to make sure every person who gets off the plane must fill in information and provide details to public health authorities so that they can be tracked. And, Madam Speaker, that means doing the job properly, not just relying on people to do what they say they'll do, but checking them with the sort of technology that's being used overseas that every Tasmanian has available, which is a phone and a GPS tracker. So, Madam Speaker, Tasmanians might feel uncomfortable about this, but people will feel far more uncomfortable far worse if there are people who are severely ill and dying in our hospitals. That can be avoided, and we must do everything we can to avoid that. It is quite an easy matter to have an automated text message that a person who is self-isolating simply replies to. It will give a GPS a record of where they are and make it clear that they're where they're meant to be. If there are serious penalties, if the Premier is serious about using the penalties available, then he has to actually make them work. And in order to do that, public health staff, biosecurity staff must be getting resourced so that there is the amount of staff available and the machinery available for them to be able to do this job. And before I finish, I just want to also add to what the Leader of the Greens has just said about schools. It is very uncomfortable for me as an epidemiologist to repeatedly hear what we're hearing at the federal government level, that the advice is not good enough to close schools at the moment. That is not consistent with what is happening everywhere else in the world. The sorts of advice that's being provided does not come with expertise and expert evidence behind it. It's an assertion that that is the best possible advice. In fact, every single country in the United Union has closed its school, Madam Speaker. Not the UK, but they're not in the United Kingdom anymore. Every single country, European Union, And most of the Middle East, almost all of the Middle East has closed their schools. Most of Asia have closed their schools, Madam Speaker. The reason they're doing this is because it is effective. Tasmania today should be expecting, the Minister for Education should be directing schools to be closed this week. We have the advantage of time. We can change that decision in 2 months' time if the Tasmanian data show us that it's no longer needed. It is not a commitment for 6 months. It is a commitment for a probable 2-month period. Over the Easter, we've already got that time. We've got the time. We need to take advantage of it. We have teachers today with an intolerable burden. We have parents with an intolerably difficult decision to make about the health and well-being of their child. These are decisions that should be made through leadership on a statewide level for the whole of society, so we can all pull together and make sure we avoid needless suffering for vulnerable people.